Hello, welcome to this video. My name is Christiana. I'm a public health practitioner. In this video, I would like to talk about 7 main factors that control your blood pressure. The first one is your body weight. So whether you are being overweight or obese, simply what is happening is that you are adding extra, tissues to your body. And these tissues are specifically fat tissues or adipose tissues. And what happens is that these tissues do not just lie idle. They produce certain chemicals that interfere with the hormones that naturally control your blood pressure. A typical example is aldosterone. So when you have excess fats or you've gained a lot of weight, what happens is that these fatty cells or tissue produce certain chemicals that cause your adrenal gland to keep pushing a lot of aldosterone into your blood. So it causes consistently high blood pressure. Then another thing is that the excess fat or tissues that you are adding to your body, your heart needs to still supply this tissue with blood. So now your heart will have to work extra hard, to pump extra hard to be able to supply blood to nourish this fatty tissues. And it's important to note that as you approach 40 years, your metabolism goes down. That's how your body digests food and break down to provide energy to you. And your fat storage also increase. Your body tends to store a lot of fat. And it makes sense because metabolism slows down. So this is the time that you see a lot of people, developing a bigger abdominal pouch, which is commonly known as the pot belly. Yeah, so you see men 40, 45 begin to develop pot belly, and in women as well. Now, the next factor that controls your BP is sodium or salt. In fact, salt is sodium chloride. So there is sodium in there, sodium and chloride. So excess eating of salt or consuming food that are high in salt, what happens is that it causes your blood, your blood vessels to become hardened. So it creates resistance for your heart to pump blood through your body. And then another thing is that once salt level or sodium level increases in your body, it causes your kidneys to retain more fluid in your body. And when this happens, your blood volume increases. So now your blood level has increased, in quotes. So the heart will have to use extra force to be able to push the blood through your body to the various parts, organs and other parts of your body. So you've given your heart extra work to do. Then another thing is that the next point is potassium. Now, when you eat potassium and sodium, in fact, their relationship is inverse. So as potassium level increases, sodium level decreases. So if you eat foods that are high in potassium, what you are doing is that you are telling your body to flush out excess sodium in your body. So the body will flush it out. However, if you eat food that contain low potassium, what happens is that your body will be holding on to sodium, more salt, more sodium, and then it will increase your, fluid level in your blood volume, and then your blood pressure also increases. So you are giving your heart extra work to do, and then eventually your kidneys will give up because they are also working hard, to maintain a normal potassium and sodium balance in your body. The next factor is alcohol. In fact, drinking alcohol adds excess calories, which in excess could be burnt, could be saved or stored as, bad cholesterol, LDL. And we know this is the cholesterol that clogs your arteries, blood vessels, and, cause resistance for your heart to pump blood through your body. So why would you want to keep on holding to the alcohol? It's very important to, control alcohol intake. At most, maybe a drink a week is fine, or a drink or two is fine. So that is very important. Then another thing alcohol does is that it causes hardening of your vessels. So just like sodium, excess salt. So your vessels becomes hard, and then blood flow becomes difficult. So the heart will have to work extra hard. Then the next factor that controls your blood pressure is stress. So when you are stressed, then the body begins to produce stress hormones. And the stress hormones, wherever they go or whenever they are produced, they cause increased blood glucose level. They cause increased hunger. And they cause you to, indulge in certain risk factors, such as overeating. You are likely to, crave for greasy foods, oily foods, which are not good for you, obviously. You are also likely to be depressed. You are likely to, indulge in alcoholism, high intake of alcohol. You see some people after work, they say they want to take a beer to relax themselves, some whiskey and all that. Really, taking alcohol to relax your body, you are doing your body no good. So please, I want you to, change your mind from, change your mindset. Alcohol does not relax your body. It doesn't happen like that. You are harming your blood vessels, you are harming your heart, and then you are just working towards, diabetes, hypertension, and other heart, problems. So it's not good. Then the last one is smoking. In fact, smoking directly physically damages the lining, the thin lining of your blood vessel, and this lining is what controls the dilation, the opening and closing of your arteries as blood flows from the heart through them. So when you are smoking, it causes hardening of this artery. Your arteries become hardened, and when they are hard, it means the heart will have to pump harder. There is resistance. And also, because of the endothelial dysfunction, the damage to the lining of these arteries, another thing that happens is that it causes abnormal clotting in your blood vessels. So your blood just clots anyhow, and once that clot dislodges and goes to your heart, it's going to block blood flow to some part of your heart, and will result in heart attack. So heart attack is when there is a clot or a fatty plaque blocks the coronary artery, the artery that supplies, the heart pumps to other parts of the body, but the heart muscle itself that is working also needs that blood and oxygen to work. So when the clots or the fatty plaque, cholesterol, due to high cholesterol, blocks the artery, then it means that part of the heart that is supposed to be supplied by that artery, it does not receive blood anymore. So it could die off. So that is when we say the person has heart attack. So with smoking, so if you have a high BP and then you still smoke, you are just quickening the process of getting a heart attack or a stroke. A stroke is a brain equivalent of heart attack. So when there is occlusion in the artery supplying part of the brain, it could cause a lack of blood flow to the brain, part of that brain, or if the artery ruptures due to high blood pressure, bleeding into your brain, and then it causes stroke. So please quit smoking. It's very important. You just need to go to a facility, speak to your doctor that you want to stop smoking, and then they will take you through the process, and then you'll be assisted to stop smoking. So please, it's very important. Regardless of what you smoke, once you smoke, whether cigarettes, marijuana, anything, please, you need help to stop smoking. So these are the factors again: smoking, stress, alcohol, high salt intake, low potassium intake. I also mentioned age, and then the last one is what? Your body weight. So those are the key 7 factors that control your blood pressure. Thank you for watching this video, and please share with your friends. Watch out for more videos. Bye.